Gastrointestinal bleeding, causes and treatment. Hi, I'm Tom, a gastroenterologist and hepatologist based in Melbourne, Australia. Gastrointestinal bleeding can occur for a variety of reasons, and it is important to understand the root cause in order to effectively treat it. One of the most common causes of gastrointestinal bleeding is peptic ulcers. These are open sores that develop on the lining of the stomach or the upper part of the small intestine. Peptic ulcers can be caused by the bacteria Helicobacter pylori. Prolonged use of non-steroidal anti-inflammatory drugs, or NSAIDs, or excess alcohol consumption. Another cause of gastrointestinal bleeding is esophageal varices. These are enlarged veins in the esophagus that can rupture and cause severe bleeding. Esophageal varices are often seen in individuals with liver cirrhosis, a condition characterised by scarring of liver tissue. Other causes of gastrointestinal bleeding include inflammatory bowel disease, gastritis, and colorectal cancer, to name a few. When it comes to treating gastrointestinal bleeding, the first step is to identify and address the underlying cause. For example, if the bleeding is caused by a peptic ulcer, medications such as proton pump inhibitors or antibiotics may be prescribed to heal the ulcer and reduce risk of further bleeding. In cases of esophageal varices, procedures such as banding may be performed to stop the bleeding and prevent future episodes. In some cases, surgery may be necessary to repair the source of bleeding, such as removing a section of intestine affected by diverticulosis or colon cancer. But this is rarer, and most often bleeding can be treated by gastroscopy or colonoscopy. Blood transfusions may also be required to replace lost blood and improve the patient's overall condition. While it is not always possible to prevent gastrointestinal bleeding, there are some strategies that can help reduce the risk of developing this condition. Maintaining a healthy diet rich in fruit, vegetables, and whole grains can help promote digestive health and reduce the risk of developing ulcers or other gastrointestinal issues. Limiting the consumption of alcohol and avoiding smoking can also help protect the lining of the stomach and intestines. Regular exercise and maintaining a healthy weight can help reduce the risk of developing conditions such as obesity and type 2 diabetes, which are known risk factors for gastrointestinal bleeding. It is also important to follow your healthcare provider's recommendations for managing chronic conditions such as liver cirrhosis or inflammatory bowel disease to reduce the risk of complications that could lead to bleeding. In conclusion, gastrointestinal bleeding is a serious condition that requires prompt medical attention.
Note, this video is not a medical consultation. Any medical information is general in nature and is not intended to provide individual clinical advice. You should contact your doctor or other healthcare professional in relation to any concerns they may have, as your own circumstances may be different.
And if you'd like to learn more or book a consultation, visit our website.